David Morin and samsmall, a clinical approach to massage therapy, on the Alternative Health Tools podcast, where together we discover and share new alternative health tools and resources from alternative healthcare practitioners and experts.
Hi, welcome to Alternative Health Tools. This is your co-host, Kim Shea, on this side of the pond in Southern California. Today is Wednesday, June 2nd, 2021, and I am speaking with David Morin and samsmall today. David Morin, and he also has a partner, Juanita Thompson, who's not with us today, but they are clinical massage therapists, and combined, those two have 80 years of therapy and instruction history. They are clinical massage therapists, and their goal is client-centered, results-oriented massage as healthcare to treat specific soft tissue injuries, pain, and conditions. So it's not about a relaxing massage. It's about really helping you to get well. And it also is centered on the therapist having a better experience and a healthier experience so that they're able to do what they do for a longer period of time. And David is a licensed massage therapist for 40 years, researching and applying, including 2 Olympic Games you were involved in. I'll be interested to hear a little bit more about that. I also have samsmall here with us, and he is a content producer, and he's in charge of marketing and has collaborated with David. He's also a former client of David's, and so he knows really thoroughly what David and Juanita have to offer. So I'd like to welcome you both here to Alternative Health Tools.
Thank you, Kim.
Thank you, Kim.
Thank you. David, do you want to tell us about your background? How you got into this?
Pleased to be here, and thank you. Yes, I suffer from a good education. I've been to 4 undergraduate schools and 4 graduate schools, and when I finally entered massage therapy at the age of 36, I had a degree in biological sciences with a minor in chemistry. I had done the graduate work in anatomy and physiology, vertebrate anatomy and physiology, and had been a medical photographer in Vietnam, and a variety of medically oriented things, including being an ambulance driver and different sorts of things in the medical realm, you know. So when I got into massage therapy, I automatically just naturally gravitated toward the most technical, the most clinical, the most anatomically and physiologically connected type of work. It was boring for me to do a full body massage where the person would just take a deep breath and sleep and just snore even while I was delivering a nice full body massage. It got boring to me, and what I found to be much more demanding on my mind, and that is to become more clinically oriented. And as I did that, I began to have people coming in asking for specific work on specific problems. And that's the way my practice changed. They weren't coming in anymore and saying, I want a nice full body massage as deep as you can deliver it on every aspect of my muscle groups, and I would have to be standing and moving around the body and delivering that full body treatment while they were relaxing or perhaps talking about their family or their family dog or whatever they might talk about. It was boring to me. But I found that when a person came in with carpal tunnel syndrome or plantar fasciitis or a whiplash injury, I just got very excited about how many ways could I help them in addition to what their physician, their chiropractor, their physical therapist might be doing. Not trying to do any of those things because that's clearly not what I'm prepared or trained to do. But I am trained as a soft tissue specialist, and that means the 200 bones and the 600 muscles and where they interact and intersect and attach and originate and insert is all in my wheelhouse. So it turns out that in almost every kind of syndrome that you can name or problem that a person would be suffering with or going around suffering with, carpal tunnel syndrome and many, many other syndromes, there is always something that can be done with the muscles and the myofascial structures of the body, and that's what I capitalized on. That's where I focused my energy. I had the technical background that so many people coming into massage don't have, the anatomy and physiology, and including three semesters of comparative anatomy. So I was really prepared for clinical work. And I began traveling with my university track and field team at University of Texas El Paso. I traveled with them for 8 years, men's and women's track and field. And along the way, we had some very fine world-class sprinters who hired me to go to the Olympics in Atlanta in 96, and then again in 2000 in Sydney, Australia, where my athletes took gold in the 100-meter relay and bronze in the 100 meters. So,
congratulations.
Fairly successful on that plane, you might say. And I came back to my practice and realizing that everybody is the same. We're just somewhat not quite a little bit removed from being the quality of an Olympic athlete. But you or I or other people my age and your age and everybody else's age can have all manner of difficulties, whether it be knee sprains, groin strains, hamstrings, anything. It can all be involved with people that are trying to raise a family and teach a class and get along with life and be a consultant as you are, and so many other professional motivations. So it became natural. And that's what I've dedicated my practice to. And it's now 42 years. I just retired last year at 42 years. And it has been a wonderful journey. And what I started doing is teaching what I was doing, because so many people saying, David, I've never had anything like this. In fact, I've had the comment that, David, I've been in 50 countries and had massaged in 50 different countries, and no one has ever done that. And I like it. So there's something interesting and different there that I've picked up along the way. I'm not saying I created or developed everything. I studied with every master I could. Anyone that had anything going, I was going to go get a treatment from them and read their book or take their class and incorporate that into my background, which is now quite broad. So I'm bringing a lot to the table academically and historically and experientially as well. And what our focus is, our market, you might say, for the courses that we teach. We're teaching courses, and we want people to sign up for them and use them effectively and get really great results with them. The market that we have for our courses is any licensed massage therapist who would like to become more clinical in their work. Now, there are lots of conditions for which a relaxing full body massage is the ideal treatment. Think of someone who's recently had a loss in the family, anxiety, depression, all manner of problems. A properly delivered full body massage is perhaps the very best treatment that anyone could possibly deliver for certain maladies and certain conditions. However, for whiplash, not so much. We need to do specific, consistently specific, and also very detailed work on the neck and all the 16 muscle groups that interact with the neck and that can be involved in traumatic brain injury and in post-concussion and in whiplash. So that can get very technical and very comprehensive. So that takes a very special set of skills, doesn't it, to become that tuned in, that delicate, and yet that precise. So that is the market that we are seeking for, the larger market. And the smaller market is along the way, as I've gotten older, I become not as athletic as I used to be. I'll be 80 on my next birthday, and I'm just not able to lift those heavy bodies and legs and arms and move them all around as I used to do so easily and freely. So I've converted my practice to one of being mostly seated and still getting very good specific results with whiplash, with carpal tunnel syndrome, because I can be seated on a stool and deliver marvelous therapy over a period of time and get consistently good results and not have to stand, not have to lift, and still be able to do the work that I know how to do. I can illustrate that probably with a quick story. I had someone call me when I was back doing the live classes and said, David, I'm 60 years old. I've been a massage therapist for 20 years, and I'm just having difficulty getting around the body to deliver these deep tissue massages that these people want. That means where you press as deep as you can and as far as you can and just they walk out hurting but happy, so to speak. And I just can't do it anymore. Plus, I now have a herniated disc in my back, and I'm thinking about retiring. And I said to her that the class coming up happened to be the head and neck class. And I said, ma'am, you come to that class, and you get real good at neck and jaw treatment, and you can literally be seated and become a neck and jaw specialist. and get referrals from dentists with restricted jaw opening and problems around the mouth, from speech therapists perhaps, with people with lazy tongue and inability to use their maxillofacial muscles, and also from physicians. And you could become a literal specialist, and you'd be seated, and it wouldn't put that pressure on that herniated disc in your back. She came to the class, and she did it. She's now doing that. That's rewarding to me. That's what I'm about. That's what this whole thing is about, is people being able to continue doing what they love to do and yet not have to stand up all the time, not have to lift heavy bodies, and not have to answer the demands of a client who would be saying, can you go deeper, please? My last therapist could go deeper than that. And if you want me to come back, you've got to really you get a hammer out and beat me up a little more. So massage therapists are tired of hearing that. They really are. We really are tired of hearing that, because therein is not the healing. The healing comes from within, not from us anyway. So we're not healers. I don't claim to be a healer. I would never use that word. Never would I use that word. But healing is there. It's there for all of us.
I love that. That's great. Do you feel like you're living your purpose?
I'm living my purpose.
I like that. I could sense that. That's great. Okay, so Sam, tell me about you. What's your background here? How'd you get involved in all this?
Well, I have a degenerative disc disease. And I'm 64 years old now. Over 30 years ago, had my first surgery and had enormous amounts of muscle spasms and pain and discomfort resulting from that. And so I went on a quest looking for massage therapists who could help me. And I quickly found everything that David has been talking about is absolutely true. A gentle, relaxing massage was not what I needed. I needed very specific work. And I had a really hard time finding therapists who understood that and that had the kinds of skills that could help me. And so life went on, and I've had 4 major surgeries now, still get massage, very targeted massage on a regular basis. And I found David, life introduced us to one another. And I was absolutely smitten with the quality of the work and the approach that David takes to massage. I immediately recognized the difference, that here was what I needed from a medical position, not just a spa relaxing massage. And so I also happen to be a content producer. I'm a media producer. I'm a director and an editor. I was just so taken with what David was doing as a therapist, but he was also traveling the country and teaching this work. And I was so taken with it and realized that this is something that the world needs. We need this, and everybody needs to be able to have access to manual therapy and manual therapists who can do this, because the opioid epidemic that we're still reeling from, was using pharmaceuticals to treat pain. And there are other ways to treat pain. And the work that David and Juanita have put together teaches therapists to be able to serve their clients and resolve pain without pharmaceuticals. And I just, I saw my opportunity as a content producer to be able to document what David does and what he teaches, and be able to turn that into an online video-based masterclass and bring that to as many people as possible. It helps the therapists, and in turn, each therapist helps their community of clients. And so, for me, that's heaven. If I can produce media content that helps people in that kind of way, I'm there.
That's great. It sounds like you're living your purpose too, Sam.
Yeah, I am, and I really enjoy the challenge. The online marketing world has been evolving over the past 10 years, and it changes on a monthly basis. So it certainly keeps my interest in finding new and different ways to reach out to different communities, and bring this coursework in front of massage therapists worldwide so that they can advance their careers into this clinical or medical specialization.
That's great. I know I have a friend who's a physical therapist, and she does a lot of body work on people. And she recently retired, and she was probably 49, 48 when she retired because it was just too hard on her body. So I think this is great if you have people who are doing something they really love to do, and then they can extend what they're doing longer. Sam, how do you feel like what your disease is or your condition is? How do you feel what the status is if you had not found David? Where do you feel that you would be? Do you feel that there's a marked difference that you've achieved in the quality of your life or how you're feeling based on the massage therapy you get?
Well, yeah, especially post-surgically, I've been fortunate in that I've had 4 catastrophic disc failures, spread apart by 5 or 6 years each. And I've been able, with the help of massage and trigger point acupuncture, have been able in those intervals to live comfortably and have good mobility. I'm hopeful that I can avoid a 5th surgery. And because of the work like what David does, I do live comfortably. Post-surgically, able to resolve muscle spasms and resolve inflammation. And as David says, he doesn't. The work allows my body to reach its homeostasis and reach my own ability to heal myself. So my body does the healing. David does the facilitating to remove the barriers that are keeping me inflamed, keeping my nerves inflamed or keeping a disc inflamed. This work can help remove those barriers so that my nervous system and the nerves and the tissue can release inflammation and promote its own healing. The body is the healer. The therapist is just the facilitator.
Yeah, I think all good therapists say that. They all say that they're not doing the healing, they're just facilitating it. And it's a very gracious way to view what you do. And it's such a nice thing that you do. So let me ask you, David, also about Juanita. If you could tell me about Juanita, and she's your partner in all this and doing the online instruction. Is that correct?
Totally. We met in massage school in 1978. She was, prior to that, a cardiac nurse at the Miami Heart Institute and other places, had a tremendous background in cardiac work, and so a clinical background on her part from her years of doing that, and it meshed rather well professionally as well as personally with myself, and we became very close, and we started a practice in Sarasota right after massage school, moved to Sarasota and set up a practice. set up a rather booming practice, I will say. We started teaching at the local junior college, and we went out and met some physicians and talked about what we were doing and invited them in to have a session or send their head nurse and get the credibility that we desperately needed in the professional area, so that we would have that avenue where we could be functioning properly and successfully. And it worked. After 5 years there, we moved to Ruidoso, New Mexico, and we started the first school in southern New Mexico in 1987 and had a massage school for many years. She continued that for another 23 years. We have a son together. She was the mistress of the best massage school there in New Mexico, southern New Mexico anyway, and had a fantastic experience. And we have taught together for many years. I have taught in her school at times, even though we were not together. We had divorced in 90, and now we've progressed all the way to friendship, and we share a property in New Mexico. So we've achieved a rather almost impossible task of becoming acquainted and then married, and now all the way to friendship. So we rejoice in that, and she is a tower of knowledge, has background in being a midwife, as well as a nurse, as well as a school owner, as well as a massage therapist, and is a tremendous source to this program. She adds so much and has added so much to this program that now the manuals are compiled and presented by both I and she. Her name is on everything because she has added so much in the way of contraindications, in the way of precautions, in the way of understanding how we need to be working with people clinically. And she added a course to the program as well. She made our 5 courses into 6 courses by adding a very wonderful course that everyone likes. So it's a joy. It's a joy to have that kind of a blend. And that's 42 years of experience. So we literally have 84 years of experience between us.
That's pretty incredible.
They are both rock stars.
Yeah.
When it comes to massage, and recently acknowledged at the World Massage Festival into the Massage Hall of Fame, recognized in 2019.
That is really great.
Yeah.
That's really cool. So tell me how long, like if a student wants to contact you, somebody who's already licensed massage therapist, right? That's what you said. And so then how long is the program? How long will it take them to complete your program?
They can, massage therapists can find us at therapyedu.net.
We'll have the link in the show notes for you guys. Yeah.
Great. Thank you. And the basic master class, I call it basic is really not the right word. It's comprehensive. It is a very comprehensive online video-based master class. And typically we advocate a working therapist spend at least 5 hours a week dedicating themselves to watching the videos, reading the 360-page course manual, and practicing the techniques on very lucky friends and family. And if they follow that a pace, they'll be able to complete our course comfortably in 5 months' time. There's 6 modules. The body is broken into different body parts: cranium, upper extremities, lower extremities, hip and torso. And then we also have an extensive course on documentation, which is a big part of the clinical aspect. The record keeping and the clinical protocols that we follow, that we encourage our therapists to follow. It's the same, essentially, it's the same medical protocols that a doctor's office keeps, so that there is an accurate record of the patient's progress. And that affords an opportunity for our therapists to be extraordinarily client-centered, results-oriented. There's assessments. They come in. Your first session with a medical massage therapist is an intake, an extensive intake with, physical movements that we teach them how to measure. We have a little protractor device so that they can, if you're having trouble lifting your right arm, well, we want to know, how far you can lift that right arm and what's the limitation that you're experiencing. And that gets recorded.
Before we ever touch you.
Yeah. And that gives a benchmark for progress for the therapist to be able to demonstrate, and the client to be able to see themselves that, when I started this, I only had a 35-degree range of motion and I couldn't get my arm up any higher than here. And now after 3 treatments, look, I can get my arm all the way up. That drives people. That's a demonstration of healing that has taken place. They've advanced themselves. They've improved their health from this work, and that's encouraging. That people just light up when they see that kind of result. That's what they want, and it translates into pain remediation as well. Because what's stopping them is pain. And so suddenly they're pain free and they have their full range of motion back, or whatever they're going to be able to get if there's an injury or a condition that's stopping it. Our therapists know how to do that. And that takes a while. It's a very comprehensive course because there's a lot of different body parts. There's a lot of different, very specific injuries and medical conditions that massage can have an impact on. And all of them are included in the research that David and Juanita have done. And all of them are included in the course, as well as pains and conditions and injuries that we know that massage cannot have an impact on. Nobody's time should be wasted or get your hopes up, coming into one of our massage therapists that they're going to be able to work a miracle on something that we know massage is really not going to help. And so those are, included. All of and in the medical terminology, it's indications and contraindications. We're teaching our therapists how to recognize having the critical thinking skills, doing the assessments, observing their client's posture and their movement, and measuring their range of motion. Working with them on discerning pain level so that they know how to progress, how to build a treatment plan so that they can achieve a result for that client. And essentially, it's kind of counterintuitive. Our therapists are geared towards making it so that the client does not have to come back. Some practitioners, they want, therapists, you're going to come to me. I need a new porch. I need to add a bathroom on my house. And I want you to come back to me for the next, every week for the next 2 years so that I can build my deck. That's not what this is about. Our therapists really do take the approach that we want to, as quickly as possible, get you back pain-free, full range of motion to whatever extent you can have, so that you do not have to come back to us. And if we're successful in doing that, then we know that you're going to tell everybody. And that's the best word of mouth.
Kim, we do still offer a monthly maintenance program. There's times when folks have come in and gotten something pretty much better, and they do want to be placed on some sort of maintenance. And so I'd say check in once a month for a while and see how that goes. And certainly if they've been referred by another massage therapist to me and to our practice anyway, it would be a matter of returning to their regular massage therapist, because for years, I've not done any full body massage. So if I get lots of referrals, and our graduates, I would hope, get lots of referrals from massage therapists who know that they are not going to take their clients, as it were, because they're there to work on their carpal tunnel or their plantar fasciitis or their knee problem, and then they would return for their full body massage. So it's not a matter of referring completely or forever, but rather for the time being to get that specialist work done.
You're not stealing the client.
No, exactly.
You're just helping them with a particular problem, and then they can go back.
Now, I will say that our graduates, after they complete our course, it is not required. We don't require them, certainly, to let go of full body massage. We don't say whether they do or not, or should not. It's up to them completely, because they're the manager of their own world. However, I will say that there are advantages. There's some distinct advantages health-wise if a person lets go. If they're having that disc problem that therapist I mentioned was having, she was more than happy to let go of all full body massage and become a specialist and sit down on a rolling stool and work with a frozen shoulder or a whiplash or a TMJD when a person couldn't open their mouth properly, whatever, and get tremendous results by doing that, and not have an expectation on the part of the client that they were going to all of a sudden stop doing that and go down and massage their leg or their feet before they left. No. So one way of removing the tendency of a client to say, well, what about the rest of my body? I'm here. I want you to work on the rest of it too. The way of removing that from their realm of expectation would be to become a specialist and allow them to return to their own choice of full body massage therapist, their regular generalist who does their maintenance work, you might say, and yet they're always open to going to a specialist if they need to. So that's the niche that I have carved out for myself over the years, and I certainly represent that to folks and encourage them to give that every consideration, because that's what's lacking. My comment is that doctors give drugs, chiropractors adjust, physical therapists give exercise, and massage therapists do that nice full body massage. But who's going to do that specific work? Who's going to help that person who has a traumatic brain injury and no one will work on their neck because they're scared to, or because they don't think it'll help?
Yeah.
Who is going to do that? Well, there are those of us that really enjoy this kind of work who are available to do that, and that's the word we want to get out.
I think it'd be very satisfying to see somebody come in with one of those conditions and then watch the progress. It must be really rewarding.
Thank you for saying that. That leads me right to something I want to say that is a corollary to what Sam was saying a moment ago. What I used to hear, and I know that every massage therapist in the sound of my voice has heard this. I would bet money that every single one of you massage therapists have heard this from a client. Oh, that was a tremendous massage, one of the best I've ever had, Kim. And you say, well, thank you very much. I appreciate that. That means a lot to me. And it did. It did mean a lot to me when they said that. However, when it all changed is when a person would come out and say something like, 4 visits with you have helped me more than 12 weeks of that other therapy, whatever it was. 4 visits. That's changed my life.
Wow.
That's a different story.
Yeah, I'll bet.
And that's what changed my life. When I began hearing that, and I knew it wasn't me, it was partly me, partly them, and partly the work. It's the work. Mm-hmm. It's not about me. It's about the work. And the work carries the day, always.
There's a lot of passion you bring to it too, though, David.
I do. A lot of passion.
Can tell.
And it's particularly timely. The nation is still reeling from this opioid epidemic. And the Hospital Association last year mandated that all federally connected hospitals have at least 3 forms of non-pharmacological pain remediation. They're trying to give people an opportunity to manage their pain without using pharmaceuticals. And massage and clinical massage that dovetails with doctors' prescriptions and chiropractors and PTs this medical massage that David and Juanita have created is absolutely spot on for playing that role, giving people the opportunity to resolve their pain without pharmaceuticals. And that's, that's just great.
That is great. And that brings me to my next question. That I think we discussed this before we started recording, is there are other job opportunities for people who become specialists? Is that there are other opportunities where they can explore work as opposed to having a studio and a table? What else can they do now?
The beauty of this experience for me, Kim, has been that with the work that Sam has done to present this course online, where we can have students from countries that I can't even pronounce, it's amazing. And invariably, almost to a person, each one, even after their first course, they have to evaluate each segment after they cover that module and take a test on it, and then evaluate it and tell us what they think. And I mean, they tell us what they think. And sometimes if something's not right, they'll say so, and they need to say so. However, what I'm hearing is an excitement, and that's from doing something online. They've never met me. They've seen me in countless videos and through the course manual, but they're able to get jobs in hospitals, and sometimes working on just the staff in a hospital. That's curious, isn't it? And other times in hospitals to work on certain patients in the orthopedic ward, for instance, and certainly non-communicative wards, etc. In medical clinics, DC, chiropractic clinics, physical therapy clinics, and then massage therapists gathering among themselves and creating their own clinic or individual private practice. So there's many avenues for them to practice. And I love to say to a client, to a student, that the opportunities are so bright that the future is so bright they just have to wear shades, because it's just that much of an opportunity. I don't mean that there's ads in the paper every day. There are some. It's often a matter of creating your future. I will say that.
Okay.
And that comes into play as well. But I love to be able to say to a person that they don't have to ever give a deep tissue massage again unless they want to. If they don't want to, they can move on and become the specialist that they deserve to be and help people in so many powerful ways that they will never look back on walking around a table and having people demand more pressure, or would you spend a few minutes more on my left ankle or something like that. They're there to get the therapy that you are delivering for their stated goal of more freedom in their neck or their shoulder or their back. And it's maybe 10 times more rewarding, I would suggest to you.
It sounds great. It sounds really inspiring. How do we find these people? How do we find people who graduated from your program? Or what, if we're not a massage therapist and we're listening to you right now and we'd like to find somebody in our area, what should we be looking for?
Well, we'd very much like to have and have in motion developing a find a therapist feature. And we love to refer people to other therapists when they ask for others in their area, or someone they could study with, or someone that might be in their area. Sam, you might have the comment there.
Yeah, there's a page on our website, therapyedu.net. There's a find a therapist link on that page, and people will be able to search by their state and city to be able to find a graduate of our program. Yeah.
Perfect. And you said you have people all over the world taking your course.
We do.
Yes, in many countries. I would say most states. I can't think of a state right now that we have. There might be one that we haven't had any students from, but I think every state, and certainly Canada, and many in Australia and many other countries.
Okay, that's great. That opens up opportunities for everybody here.
Kim, you mentioned, your PT friend that was retiring because their body was wearing out. That is another aspect, and a very unique aspect to the work that David has put together. Because as he aged, he blew his thumbs out a long time ago.
Oh boy.
And is not able to, apply sustained pressure using his thumbs. He can't do it. And so to be able to stay in this industry that he loved so much, he had to find another way to work. And so all of that, has been incorporated into the coursework that we have. There's probably close to 200 different techniques, massage treatments that David demonstrates in this course to treat various different muscle injuries or conditions. You have to go, treating, and it's all documented. How to reach that muscle, how to put that muscle on slack to best reach it. But then also for the therapist, how to deliver that treatment in a way that's not abusive to the therapist delivering the treatment. How can the therapist deliver that treatment in a way that protects the therapist? It's self-care. And so
exactly, we don't want either the therapist or the client to be overworked.
And that contributes to the longevity and the interest in our students. Probably more than half of our students are 65 or older, and they come to this work because they are experienced therapists, or they're new, and they recognize that I can't deliver that deep tissue poking and sustained pressure. I can't do that without hurting myself in the normal way. And David presents an alternative that you can learn how to deliver sustained pressure. He has developed hand tools. So we teach therapists how to work with these wooden hand tools that have rubber tips. And you're able to apply, we call them thumb savers, because you can apply that sustained, focused pressure on a muscle or a trigger point that is locked up. And the idea is that if with the right sustained pressure, that muscle will release. It's like, I call it the reset button on a computer. Your computer's messed up, it's locked up, you hit the reset button. Muscles are stupid. They only have one response. And that is, to either they tighten and they let go. They tighten and they let go. And sometimes they tighten and they forget how to let go. And this trigger point work delivers very similar trigger point acupuncture, delivers the same similar kind of stimulus that gives the muscle, it's the reset button. And the sustained pressure from a massage therapist can do that as well. David has studied intensively with Janet Travell, who developed this entire understanding of trigger point therapy. And it works. And he has other techniques to be able to give the therapists, our graduates, an opportunity to deliver their therapies from a seated position so that they are not standing all day. He has what we call more pull, less push techniques. Therapists, they're constantly pushing. And that takes its toll on their forearms, on their shoulders, on their backs, on their wrists. And so David has developed alternatives to that. And some of that is facilitated. I want to take a step as well to say, our clients don't get undressed for massage. This is clinical.
Yeah, it's all clothes on.
This is all, and that's an entire game changer for the therapist, because it completely.
The clients wear a t-shirt and shorts or sweatpants.
It changes the dynamic of what's taking place in the room. It's particularly attractive to male therapists because they're subjected to all kinds of fantasies that, in a room where somebody's getting naked. It's the only, in a doctor's office, a doctor has to have a nurse if a female patient is getting naked in the room. In a massage clinic, that's not necessarily true. Somebody could be naked under that sheet with a male therapist, and that's a problem for a lot of people. A lot of people with body issues, body shaming issues, they're not going to go and receive a massage if they have to get naked, if they have to undress. And so this clinical approach where the client stays clothed, and we're teaching our therapists to be able to deliver massage through a cotton t-shirt or through a pair of sweatpants, and they can still feel, takes a little bit of practice, and even working with the hand tools, it takes a little practice, but you can learn how to feel what the client's muscles are doing and be able to deliver the right pressure in the right place. You can do that through clothing, the right clothing. You can't, it's not blue jeans, it's just a simple cotton shirt or lightweight sweatpants. And that changes the dynamic. It allows the client, when you're practically naked on a table, and most massage therapists give treatment that the client is either face down or face up. Because if you put somebody on their side, the drape tends to fall off and suddenly they're exposed. And that's a problem. Well,
so they don't use side lying.
They don't use the side lying position. So you got front, back, left side, right side. So we are offering to double the amount of access that a therapist has to a client's body.
That's really interesting.
Can I tell you a quick story,
Please.
Kim, that might illustrate
Please.
this a little
Yeah.
more? Another call came in from a therapist I remember in Berkeley, California. So she asked me why should she take my class if she'd studied with everybody? And I said, well, many sections of the class might be similar. The anatomy, the assessments, the physical, the remedial exercise, the hydrotherapy might all be very textbooky and very similar. But the difference in my class will be the techniques, because I'm a collector. I've been at it for 30 years, and I've collected all manner of techniques and approaches from a variety of sources, a wide variety. And I just said to her, if you're any kind of a collector, then you've just got to come and see my collection. And she said, you got me. I'll be there. And she showed up.
Yeah. And then is she doing
she's
what?
Doing the work. She liked it. She said yes.
That's great.
And in fact, she responded in a way that many other very knowledgeable therapists have. And I've had some really top-notch people take my class. And they said things like this: David, let me be clear with you. A third of what you presented, I'm doing already. So it was validating for me. A third of what you presented is stuff that I already knew about, but I'm not using. And I realized, why am I not using this? David inspired me to go back and dust this off and add it back to my routine, my approach. And another third, the third is new stuff that you have shown me that I had no idea about. So it's not a matter of a therapist coming in and having to just get rid of everything they already know. I would never say that. I don't say disregard whatever you think you know because I know everything and that's the way it's going to be. No. We build on the foundation. That's why our course is for massage therapists only, because we want to build on the foundation that was built or started in massage therapy school. We want to expand that foundation to include more anatomy, more physiology, more pathology, and more kinesiology. And then they can feel confident when that person comes in and said, I was injured in an automobile accident and I can't turn my head. And my doctor or my cousin or whoever sent me to you, that you would know how to proceed. And yes, I do know how to proceed. And our graduates know how to proceed. And it's not always a matter of snapping your fingers and fixing something. It's certainly never a matter of snapping your fingers and fixing something. It's a matter of doing what we can do today and empowering and incorporating everything the client can be doing for themselves so that we empower them, not us. It's not a matter of come along with me. I'll take care of you. I'll do it everything. You don't have to do a thing, sweetheart. Just lay down and let me do it. It's not that at all. It's a matter of empowerment, of letting that person know and letting them realize that it is them, it is they who has the carpal tunnel syndrome or the whiplash. And I am encouraging them to do all they can on a daily basis to do what they can, because they're with themselves every day, and I'm only seeing them twice a week, or we are seeing them only twice a week. So it's a matter of empowering the client to become the driver of their own health bus, their own fitness bus, their own wellness bus. It's not a matter of doing it for them. It's a matter of teaching them how to do it for themselves. That's why we start out with assessment. And when we say, well, and then we start out with, how can you move your head? We say, we only move the head that far. What should I be doing when I go home? They say, the same 4 movements that I gave you when you moved in, when you walked in. The same 4 movements. Do those movements every day, several times a day, with heat, with cold, with all the different things that we can incorporate. And that's the winning combination. The therapist plus an informed client. So we want to inform them, empower them, and support them. I say, I'm your coach. I want to be your coach, your cheerleader, your consultant. I'm not your healer. I'm not your fixer. I don't fix anything. I set the stage where you can manifest that for yourself.
That takes the form of remedial exercises, which we teach our therapists to in turn teach their clients.
Okay.
So at the end of a session where it's appropriate, our therapists will teach a client how they can continue their self-care at home.
This sounds great. It's quite a partnership with the clients and then with all of you too. So this sounds wonderful.
And let's not everybody think that this work is only available online. For the graduates of our online masterclass, David still does at least twice a year teach a live 4-day in-class techniques intensive. It's none of the pathologies. It's none of the different protocols that are taught online. This is just a demonstration of the specific techniques that David has modified and designed to protect the therapist. He demonstrates those techniques live in the classroom. Yet again, they've seen them in the videos with multiple cameras and lots of close-ups so you can really see what his hands are doing. All of that's in the video, but in the live setting, he demonstrates it once, and then everybody breaks up into pairs, and they start trading the massage back and forth. And David and the teaching assistants wander the room and give remediation and offer coaching on and evaluate each individual, because at the end of that, they will earn his certification as a medical massage therapist. In the online class, they earn a certificate of achievement with continuing education hours. It's NCDTMB approved, 72 continuing education hours. That's for the online. In the live class, which is only available to graduates, in the live class, they earn another 28 live CE hours, and they earn, if they're good enough, they earn David's certification of them as medical massage therapists.
That sounds great.
We call it putting the icing on the cake, Kim. Let's put the icing on the cake. You've got a good orientation, and they bring those skills to the in class or on live class, and it's awesome to get together with these folks. And I love to do that.
Yeah, no, it sounds wonderful.
They really feel empowered.
And not everybody
after that.
can travel. Not everybody can travel anymore. You know, some people it just got too expensive. You know, it used to take 12 days in the classroom. When David only gave all of this live, That's like 4 different weekends that people would have to travel to be able to do this work. That was a very time consuming and a fairly expensive process. By breaking it down and turning it into taking everything that could be taught in video and through the manual that could be taught using a masterclass format, we've been able to chop that down. If they are able to take the live 4-day, it's optional. Not everybody can travel, and not everybody needs to. It's all comprehensive in the online. It's all there, but the 4-day live techniques intensive, as David said, is the icing on the cake. And the therapists love it because they receive. That's what we get a course evaluations from everybody who takes the class, and they constantly, I'm always amazed that they are so appreciative of receiving the technique properly delivered, because it anchors into their own body what is their client's experience. And with that, they are much more well informed when they go to deliver that same technique to their client.
Yeah.
They say it's empowering for sure.
I'll bet. Yeah. Well, I'd like to thank you both for coming onto the show and teaching us all about massage, whether the person listening is a massage therapist or whether there's somebody who just wants to look to get a better massage that is more beneficial for the
Indeed.
problems that they're having. So this has been really helpful, and I really thank you both for coming on here. So this is David Morin and Sam Small, and the website is therapyedu.net, and we will have the link in the show notes. Also, when you go on to this, if you want to look at the show notes, you'll also see there's a little microphone in a blue circle, and you can certainly go on there and press that and leave us a voicemail and tell us what you thought about this, or if you have any questions or just want to give us your opinion on everything. We'd love to hear from you, or if you just want to say hi. But I'd like to thank you all for listening, and I would like to thank you, Sam and David, for coming on and talking to us today.
Thank you for being a facilitator, Kim.
Thank you. I enjoyed it very much. I learned a lot.
Awesome work you're doing.
Thanake you.
Awesome work you're doing. Continue.
Thank you.
Please.
Thank you.
And Kim, go find yourself a good massage therapist and get.
I am. I'm already going to go look on your site. So thank you.